Yeah, we are live now.
Dr. Renju, hi. How are you after a long time?
Yes, ma'am. Very fine, ma'am. Very fine. Nice meeting you, ma'am.
Nice meeting you.
Hi, Ranju.
Hi. Same here. Hello, ma'am. Hello, ma'am.
Yeah.
Good
evening,
evening.
everyone. It is my pleasure and privilege to welcome you all today to this webinar on adolescent pregnancy, which is organized by the FOXY No to Violence Against Women Committee and the Tamil Nadu Federation of Obstetricians and Gynecologists. This very interesting webinar has four very uh, interesting talks. One on physical complications and maternal outcomes of adolescent pregnancy by Dr. K. Balakumari ma'am, and factors associated with adolescent pregnancy by Jairani Kamaraj ma'am. POSCO Act and Adolescent Pregnancy by Dr. Vivek Madi sir, and Prevention of Adolescent Pregnancy by Dr. Supriya Jaiswal. So, before we start, we'll have a prayer song. Moving on, I would like to thank our FOXY office bearers, Dr. Jaideep Tang sir, Dr. Madhuri Patel ma'am, Dr. Kiranmay Devaneni ma'am, Dr. Supriya Jaiswal, and our TNFOG office bearers, Dr. Ramani Devi ma'am, Dr. Sampath Kumari ma'am, and our program conveners, Dr. Jairani Kamraj ma'am and Dr. Aruna Suman ma'am. Introducing Dr. Jairani Kamraj ma'am needs no introduction. She's been conducting so many programs under Sexual Health Committee of TNFOG and also along with No to Violence Against Women Committee of FOXY. She's a senior consultant of reproductive medicine in infertility and sexual medicine and director at Akash Fertility Center and Hospital at Vadapalani, Chennai. She's the immediate past president of OXY and joint secretary of TNFOG. She's the treasurer of TAPIZAR and associate secretary of World Association for Sexual Health. And she's also the advisory council member of World Association of Sexual Health, South Zone coordinator, FOXY No to Violence Against Women Committee, member of Board of Studies of Dr. MGR Medical University. And she's received numerous awards like Best Doctor Award by Dr. MGR Medical University, Rajamani Janakiram University First Prize in Gynecology and Obstetrics, Dr. Vadamalayan Endowment Gold Medalist in MBBS in Obstetric and Gynecology, Dr. Arthanari Prize, and Achievement of Yeoman Service Award by Exnora 2010 and Mega TV Women Achiever Award, and Nalam Hospital Women Achiever Award, and the Best Paper Award for Sexual Dysfunction, PCOS, and Infertile Women in AOFS in 2016 in South Korea. Over to you, ma'am.
Thank you, Madhu, for that wonderful introduction and a very special birthday wishes to you, Madhu, to celebrate today's birthday.
Thank you.
I have the great pleasure and honor to welcome you all for this webinar on the adolescent pregnancy, which is a very important social problem we come across regarding the women's health. So we have this adolescent pregnancy webinar in collaboration with the Foxy Adolescent Committee and the Foxy No to Violence Against Women Committee. We with the TNFOG, we are doing this joint program about this very important condition. And we have today, I have the great pleasure and honor to welcome the chief guest for this webinar, Dr. Suchitra Pandit. Madam is a soft, sweet, but very dynamic and a strong person who is the president of Foxy between 2014 and 15, and who is the present representative to Suffolk 2024 and 26. Madam is the president of Gestosis between 2016 to 23, and she has been doing a lot of work for the gynae of all over our country. And also she is the consultant in the obstetric gynecology of Surya Group Hospital, Mumbai. And she is the professor and the unit chiefs of LTMMC and LTMG Hospital, Sion between 88 to 2009. She's a PG teacher more than 39 years, conducted very many several research projects, including the international, madam. Over to you, madam, in your busy schedule with the Suffolk. And we are very honored to have you, ma'am. Over to you for your words of wisdom, ma'am.
First of all, thanks very much for calling me to be the chief guest for your wonderful program on adolescent pregnancy with two very nice committees headed by Kiran Mai, Say No to Violence, and the Adolescent Committee, and of course TNFOG. And I know, Jairan, you yourself are very, very interested in the sexual and the reproductive health issues, and you you have a mastery in those subjects. So very, very apt topic that you've chosen. But before we talk about adolescent pregnancies, I'd just like to say, in the wake of whatever is happening in the country, I know the entire nation is devastated with the heinous crimes that has occurred at Calcutta. But in fact, after that, there have been 3 or 4 more incidents all over the country. And it pains to see that, nobody is taking cognizance of these factors. And I honestly hope now that the Supreme Court has taken this up, there will be some capital punishment declared to the perpetrators, and only then people will be scared and will not try to attempt this. And at the same time, as Kiran May has been doing the Say No to Violence Against Women programs starting in schools, I think every parent should teach their son and daughter, how to respect women, and how to make sure that every woman in the society, whoever, whatever age group she's to be respected and she's to be cared for. And every girl should be taught how to defend herself. So teach her karate, teach her self-defense, do whatever type of treatment, but tell her, and let's teach her to be bold and strong, like so many of our past Indian warriors have been. She should be like a warrior all the time. And I'm sure that I'm just waiting for the next 2-3 days, and we hope to have a positive verdict from the Supreme Court. And of course, I'd like to say that the topics that you have chosen are very interesting, particularly, what are the outcomes of teenage pregnancy. Fortunately, when we were doing post-graduation and when I was working at Sion Hospital also, the incidence of teenage pregnancy was very, very high. Now the incidence has come down, but yet we are finding that the children are a lot more sexually active, the children even from the urban group and even from the rural group. So talking about contraception is important, but then the POXO Act prohibits us, ties our hand. So I'm sure that all the organizations, particularly Foxy and all the, the Indian Medical Association, get together, tell the government, please modify that POXO Act, because much as you want to deny it, what is the truth which is happening, but don't tie up our hands for us. Let us prescribe about contraception. Let us talk about how to prevent. So Priya is going to make a mention of that. But we must know, and we must be able to prescribe confidently. So every time people sitting on top of our heads and say, you can't do this, you can't do this, but you must do this. So, how is anybody going to function? So therefore, we must have very, very clear-cut guidelines. And I'm also looking towards FIGO for having, given us some kind of a help in this particular situation. And with this, I'm going to end my talk. And I would like to once again thank Jerani, because She's always been very, very active in organizing programs. And thanks to, I didn't see Ramani or I didn't see Sampath, but all the best to Ramani because the
I
Ramani
am
ma'am is
here,
here.
madam.
yeah, Ramani, all the best to you for
I
your
need
forthcoming.
your wishes, definitely, and blessings and support.
Absolutely. And, we have Aruna Suman also there. So Aruna's results we'll know, I think, very, very soon. And I hope, Aruna, it's all good news from your side. And Madhumita, let me wish you a very happy birthday. You're also a Leo. I just celebrated my birthday a week ago.
Thank you
So,
so much.
Ma'am,
happy
we are
birthday.
all, I am also a Leo. I was just thinking, Suchitra madam, Madhumita, so many are there.
Sir. Very happy
Very
birthday
happy
to
birthday.
all the Leos in this group.
We're supposed to be
And,
lions, ma'am, bravest in the.
yes, brave and big hearted.
Yes.
So, thank you very much for having me over and all the best for your program. Hi,
Yes.
Supriya. I didn't see you there. Oh, I saw you right in the beginning.
Yeah,
But hello.
Thank you, ma'am. Thank you so
Thank
much.
you.
Thank you so
Thank
much
you,
for your
ma'am. Thank you
inspiring
so
and
much.
dynamic words and your wishes. And we are really blessed to have you here, ma'am. Thank you so much.
Thank you.
Over to you, Aruna.
It's my pleasure and honor to introduce Dr. Aruna Suman, ma'am. Ma'am has been conducting numerous programs and she's now standing for the Practical Obstetrics Committee of FOXY. She's a professor and HOD of Government Medical College in Telangana and Joint Secretary of FOXY in 2021. And she's organizing secretary of AACOG Hyderabad in 2024. Ma'am she's worked so extensively and she's organized numerous conferences and she's a national coordinator to No to Violence Against Women Committee. And she's also Practical Obstetric Committee FOXY member from 2024 to 25, South Zone Coordinator of FOXY 22 to 23, Adolescent Health Committee FOXY member from 2016 to 18, Vice President of
Thank you.
the Society of
Thank you,
Hyderabad.
Madhumita.
Ma'am, I would like to mention her award. She's received the Dira Award, IFS Award of Excellency in 2023 and Award of Excellency in 2024. Thank you so much, ma'am. And over to you, ma'am.
Thank you so
Introduce
much, Dr. Madhumita.
Yes.
Hello. Yeah. Can I introduce Ramani madam? Yes. Thank you, Dr. Jairani, for this opportunity. Thank you, Dr. Kiranmai and Supriya Jaiswal. My dear friends, thank you so much for this great opportunity. And it's my real pleasure and honor to introduce Ramani madam. I admire her a lot for her work she's done in endometriosis, and still she continues to do the research work. Thank you so much for inspiring us, ma'am. She's a National Vice President, FOXY 2020, Managing Director, Ramakrishna Medical Center LLP and Janani Fertility Center, Patron and President for Tamil Nadu Federation of Obstetricians and Gynecology, TNFOG, Executive Committee Member of Endometriosis Society of India, won 10 gold medals in UG and PG, 5 FOXY awards, UNICEF Certified Master Trainer for Violence Against Women, winner of Dhira Award for Contribution to Violence Against Women, MS Signature Award for Academic Excellence and Innovations in Field Work, Dr. Satyapal Awardee 2022 for Academic Excellence, Asia GCC Award for Academic Excellence 2021, authored more than 30 topics for books and more than 23 scientific papers in her name, principal investigator in POISE trial, we all know about that, published in Lancet, editor Endometriosis Update, published by Endometriosis Society of India, has citations of 2,536. Ma'am, welcome you. Please take over. Ramani ma'am.
Thank you, Dr. Aruna Suman, for your kind words of introduction. It is always a pleasure to share the dials with you. Okay, on behalf of the TNFOG as president of the forum, I congratulate Jairani and her team for this taking over this important topic of adolescence and violence, and that too at this day of our sister being horrifiedly she was like, what to say, it was a very sad state of affair that has happened in the RG hospital. I'm very sure that Supreme Court, which has taken the Suvamota investigations, will have a say and will have a capital punishment for all the people who are involved in that. So coming to the adolescent point of view, I think adolescent pregnancies, though we say it is not, still we find out even women in the adolescent age group becoming pregnant either out of wedlock or even among the married couple. So that and we know all the complications of the young girl undergoing mentally, she is not prepared, physically she is not prepared, and she has to undergo all the problems. And then next, what are the key factors that will be discussed by Balakumari? And again, the key factors in the adolescent pregnancy by Dr. Jairani Kamaraj, who's always been very active. And then the most important thing regarding the adolescent contraception, how to prevent it, that always remains a gray area, because POXO says you should not prescribe. But as a consultant, we need to protect our own young adolescent girls from unwanted pregnancies. We are supposed to do. So we are caught in between that, whether to obey the POXO law, Act or obey our own inner feelings. As Dr. Suchitra has rightly pointed out, that we have to help our own adolescent girls in some way to prevent. And again, regarding the POXO Act, though it is commonly mentioned, every time when we listen, it has got its own new points. And today we have an excellent speaker who is going to talk on that. So I wish the organizers, Dr. Jairani Kamaraj, Dr. Aruna, and everybody, good luck for this webinar. And special wishes to Dr. Aruna for winning this election. And then I am also happy to share, yesterday I completed my PhD. I finished my Viva OC. I'm happy to share with all of you.
Congratulations.
Congrats,
ma'am. Congratulations.
Congrats, ma'am.
You
Congratulations,
are
ma'am.
forever student and forever teacher. Always continue.
Congratulations.
So much.
Kiran and
Sheila.
Madam
Ma'am.
Suchitra, Madam, thank you so much for your blessings and wishes, Madam.
Sampath ma'am also has joined, ma'am.
Yeah.
Yes, so I request all of us to join together to work for Madam.
Yes.
Yes.
But Aruna from South and me for ICOG.
Yeah.
Yes,
So Aruna,
yes,
Madam,
Yes,
we have
Thank
made
you,
sure
ma'am. Thank you.
all the societies of TNFOG have voted.
Thank you, Jairani, for the opportunity. And it's my privilege to share this digital platform with Suchitra Pandit Madam and Sampath Kumari Madam also. Thank you so much.
Aruna, you can introduce Sampath. Sampath has joined.
Yes.
No introduction now. Just
Ma'am,
Yeah, you
let
need
me
no introduction,
let
Sampath.
me have
But
the
it's
honor of presenting Dr. Sampath Kumari ma'am. She's very down to earth, very approachable. Thank you so much for giving me this opportunity. Professor HOD Sri Muthu Kumaran Medical College and Hospital, Foxy Vice President 2022.
Aruna, leave it, Aruna. Nothing.
2020. She's Senate member of TN Dr. MGR Medical University, National Corresponding Editor for Jogi, and Founder Secretary TNFOG. She's retired Deputy Director of Institute of Gynops and MMC Chennai, President Board of Studies, OG, Tamil Nadu, Dr. MGR Medical University 2015 to 19. Chairperson Foxy Adolescent Health Committee. I have been a member in that. And first ICOG Distinguished GC Member Award 2021, Chairperson Women's Wing, IMA Chennai South, IMA National President's Award, and IMA TNSB Award 2021. I welcome you, ma'am.
Thank you, Aruna. Really, first of all, we should thank the organizer, Dr. Jairani, Aruna, and Kiran Mai for doing a wonderful work. This Jairani daily, she is talking about top teenage pregnancy. Anyway, we should, it is nice to share with Dr. Suchitra Pandit Madam as the chief guest, and our own TNFOG President, Dr. Ramani Madam. She has finished her PhD also as the guest of honor. And we are planning to do this, the same program. Jairani is going to do one first in Kannagi Nagar also, I think. So, training the adolescents in all ways, nutrition, sexual health, mental health, PCOS, and now the teenage pregnancy. It's really a good task. Last week, we had one program with Oxy in our auditorium. We had around 120 students from different colleges, and they have to spread the news to the other adolescent and youth. When Suchitra madam was a president, we had the youth mela. We have done in many colleges with Dr. Ramani madam, J.M. Khannan madam, the youth melas. I think 23% of our population is adolescent. And it's our duty to streamline the adolescents and the youth. We will do it. So adolescents health is world's best. Anyway, all the best and best wishes for this webinar. And Aruna, we will be meeting you day after tomorrow, I think. And all the best for the success of your committee chair. Thank you.
Thank you so
Thank you,
much
ma'am.
for your
Thank you,
kind.
Sambar.
Thank you
Thank
so
you.
much.
Thank you so
Madhumita,
much.
I forgot you, the MOC of
Ma'am.
and
Birthday wishes, birthday baby.
Thank you. Thank
birthday
you.
Birthday
baby and
baby.
our
Thank you so much,
adolescent
ma'am.
committee chair. She is also there, has joined a wonderful talk she will be giving. Thank you.
Thank you. Thank you so much,
Thank you so
Sampath,
much.
for your nice
ma'am.
words. A very special welcome to the special guest, Dr. Supriya Jaiswal and Dr. Kiran Mai. Thank you for being with us. Kiran, over to you for a few words.
Yeah. First of all, my regards and respects to Jaideep Tank sir, Madhuri Patel madam, who are always, giving a kind of blanket permission to do anything good, any activity. Sir always says, please go ahead and carry on. And then Suchitra madam, our chief guest. Madam, as you all know, apart from being such an excellent academic accolades and all, but she's so socially and all these social issues. She's so very passionate. Madam always speaks out and guides and speaks her mind out about all these issues. As Madam was saying, the incident of Kolkata really rattled us all, and we are all devastated and shocked. And Madam was talking about the capital punishment. So I would like to share one small detail. I work in a government medical college in a district. Since 2 years, we had given around 10 to 20 representations for a grill in front of the labor room as well as a police outpost. So it all fell on deaf ears since 2 years. And yesterday, after the Supreme Court hearing and the guidelines, today I see the grill immediately placed there. And we have a police constable round the clock, especially at night. So, but sadly, unfortunately, should it take such an incident for us, for our administrators, and even as I mean, we are helpless in a way. We keep on representing, but nobody responds. So these things happened after 2 years, overnight. I think after Supreme Court intervened. So this is one thing I think. Uh, No to Violence Against Women Committee, when it was formed, I think Foxy is the first organization maybe to have such a committee. Uh, the wish is that we should have less and less need for such committees. But today, when we see the violence against women has become a national agenda. It has become a priority issue right from Supreme Court to central government to all the states now. Everybody is talking about VAW. It is not a good thing, of course, because of the background which has happened, the incident which has happened. And if you see, there are at least 6 high-profile cases which happened last year, if you really count, which have really occupied the national headlines. And if you see the innumerable amount of cases which happen on a daily front, there is no count. So that apart, would also like to talk about that full stop program, which I think Jairani and uh, the TNFOG, Sampath Madam and all, I was supposed to join the program, but due to unavoidable reasons, I missed the program. So the teenage pregnancy, why we thought was important with respect to violence against women was when we discussed amongst our committee members, we saw that lack of education, early marriage, early pregnancy was causing so much of VAW that the women or the girls were not able to really stand up to it or didn't know where to complain or didn't have this financial empowerment to walk away or to fight. So we thought this was one area where we can really do some preventive work. So talking to teenage, not just girls and boys, to the parents, to the teachers, and that's one program which idea was very beautiful. But I think I should congratulate Jairani and Devnayan and everybody in TNFOG, Ramani Madam, Sampath Madam, with whose blessings Sir also had given his complete go ahead for this program. We were supposed to do it. I was very keen to join this, but even though I could not join, the program went off so well. I think 175 or 200 MSW students had taken part, and we are taking this program ahead into the slums, into the families, into the teenagers, into the parents, so that at least we can make some change in some part of the population, at least in Tamil Nadu. So this was the idea behind the Full Stop program. And my regards. I'm sorry I have taken little more time, but I wanted to talk about these two things. And all the best to Aruna, dear Aruna, for our chairperson election, and Ramani Madam, for you also, ma'am. I think would be blessed to have you in the ICOG in the top, position. We wish, and it will happen. Thank you,
Thank you,
Jairani,
Kiran.
and
Thank you.
thank you, Supriya. Supriya and myself keep doing lot of programs together, and we enjoy working together.
Yes.
So today's all the speakers, faculty, uh, wonderful topics chosen, and we'd be doing these teenage marriages, prevention, and POXO, and all this together, taking it into the community. Hopefully, best wishes to you all. Thank you, Jairani, for
Thank you, Kiran. Thank you so
arranging
much in midst of all your personal commitments. Thank you for joining us and giving your words of, which is very much important as a strength to the webinar as well as for the
Chandra
committee.
Madam has commented about taking it forward. We can later talk it. Yeah.
Yeah,
Yes,
sure.
yes, yeah.
I would request Dr. Supriya kindly say a few words. She is actually a very dynamic and very, 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 very active person. And she is actually like Sampath, who has really worked very, very great work she has committed in the Adolescent Committee. Now Supriya is taking over that as a good work of hers. And definitely Adolescent Committee of Foxy works very bright with Supriya. And Supriya, she is the co-trainer of HB Project ISO, Vice President of Patna Obituary Society, Joint Secretary of PMS AGOI Bihar and SOVC Bihar and Jharkhand. And she's the executive member of the ISOSAB National ISA Bihar and IAG
Thank you,
Bihar.
Dr. Jairani.
Yeah.
Thank you.
Over to you, Supriya,
Yeah.
for your words.
Thank you. Thank you so much for giving me this opportunity. Actually, I really have a passion to work for this adolescent committee. Although be it election or be it any conference or anything on adolescent, I really, really worked hard and I love to do that with core of my heart. So thank you all the organizers. That's Foxy No to Violence Against Women Committee, as Dr. Kiran ma'am, she said she loves working together. Even we get along very well. Touch wood, and our programs become super hit, whatever we plan and do. So I'm very happy that you have invited me to be a part of this program. I really thank the Foxy No to Violence Against Women Committee and TNFOG for having me, and Dr. Jairani, especially you called me, and I was, although those days I was busy, but I readily accepted because the date was suitable to me. And adolescent pregnancy, always given a go by Dr. Jaideep Tank, sir, and Dr. Madhuri Patel, Dr. Ramini Devi Madam as the TNFG office bearers, Dr. Sampath Madam, who's has lots and lots of work on adolescent health. I really take her as a benchmark. So what Madam had done, I really follow her. And then Dr. Jairani, lots to tell about you because you're a very good orator and you are very hardworking and very sincere work in anything you do. But sexual medicine is your passion, and the work you are doing along with Dr. Aruna Suman is really, really commendable. And being the program conveners, Dr. Aruna Suman, what I can say about you, because we have been seeing you during the time when you were with Shanta Madam. All the time you were on foot and you did so good work, and everybody used to appreciate you. And our chief guest, Dr. Suchitra Pandit Madam, the past president of Foxy, Madam needs no introduction, and she had been the She had lots of interest in adolescent health also. And I really, madam, I appreciate you all the way throughout your Foxy presidency. And moreover, you took over your Foxy presidency at Patna. So I remember those days also. And thank you, Doctor, the guest of honor, Dr. Ramini, madam. Madam, best wishes to you, and Aruna, madam, to very, very good wishes from my core of my heart. Really, I wish both of you come in to the Foxy and whatever you are aspiring for. So, and thank you everybody who's joined here. So now over to you, Dr. Jairani. Thank you.
Ma'am, you're muted, ma'am. Muted, ma'am.
Thank you, Supriya, for your nice words. And it is really, thank you so much for accepting our invite and within a short period of time for joining us with such a pleasant feel we always have joining with you. So much thankful to you. Over to Madhu. I
Yes,
think
ma'am. Yes, ma'am.
we can start the academic sessions.
Yes,
Over
ma'am.
to you, Madhu.
So, moving on to the first session, I'm really, really happy to introduce my president, Dr. Jaimala Kumaravel, who's the president of Salem OG Society, and she's also the assistant managing director at Rainbow Hospital for Women and Children. And ma'am has worked in the Republic of Ireland from 2000 to 2009. She's trained fully there, and she's undergone ultrasound training at fetal medicine unit at Royal Free Hospital in London. She's a very excellent laparoscopic surgeon, having trained under the very famous Dr. Adam Magos at Royal Free Hospital, London, and she's the organizing chairperson of our Salem OG Summit, and she's also the co-chairperson of Your Foxy South Zone. Very happy to introduce ma'am. So
thank you, Madhu. Thank you so much for the kind
yes,
introduction and many happy returns of your day.
oh, thank you so much.
The rest of your day today. Yeah.
Thank you so much, ma'am. Thank you, ma'am. And I'm really happy to introduce the Secretary of Salem OG Society, Dr. Shanmuga Vadiyu, ma'am. She's a professor, Department of OG at Salem Government Medical College and Hospital. She has 16 years of teaching experience and in teaching both undergraduates and postgraduates. She's published numerous articles in various national and international journals, and her special interest is in the field of high-risk obstetrics and endoscopy. Welcome, ma'am.
Thank you, Madhu.
Yes, ma'am. And happy to introduce our next chairperson, Dr. Hemlata ma'am, who's the secretary of Namakkal Obstetric and Gynecological Society. She's a senior consultant at RK Hospital in Namakkal and the past secretary of Namakkal Indian Medical Association branch. And welcome you, ma'am.
Thank you, Madhu.
Thank you. So, Jaimala ma'am, can you introduce our first speaker, ma'am? Thank you.
Yeah, just a minute. Yeah,
Yes,
Dr. Balakumari ma'am. Yeah, it's really my pleasure to introduce Dr. Balakumari ma'am. I just went through her CV and I was so impressed that she's the first graduate from her village. She's done her undergraduation from Stanley Medical College and she has obtained 3 gold medals in MBBS, in Ophthal Medicine and SPM. To get it in SPM, to me, I think it is great. She has done a post-graduation from MMC. She's a senior consultant, and I think at present she heads the obstetric unit of A4 Fertility Group of Hospitals. And yeah, she has done her post-graduation from MMC, a diploma on assisted reproductive techniques from Germany, and she's a founder member of Valcherry IMA, an executive member of OXY. Yeah, with that short introduction, I would love to welcome Dr. Balakumari ma'am to give her session.
Can I, am I audible?
Yes, ma'am, you're audible. Yeah, you can start screen
Yes,
sharing.
Please for the introduction, Madhu. Welcome, Bala.
Thank you, Dr. Chandra. How are you?
Yeah, fine. After a long time, it was a surprise for me. Okay, you can
Thank you,
proceed.
thank you.
Yeah. She was just 1 year junior to me.
Oh,
Stanley. Yeah.
Shall I share screen?
Yeah, yes, sure, ma'am.
Please.
Is it seen?
Yes, ma'am.
Okay. I will be talking a very good evening to all of you. I thank Dr. Jairani Kamraj for giving me this opportunity. My respects to Dr. Sampath Kumari, Dr. Ramani Devi Madam, and all the others who are present here. And I will be talking about physical complications of teenage pregnancy. I'll make it very short and crisp. See, most important thing is we have to tell about these complications to the younger teenage generation so that they take care, they keep all this in mind before indulging in any sexual activity. One second.
Please click on the screen, ma'am.
Yeah.
Yes, ma'am.
In the low middle income countries, there are 21 million teenage pregnancies that are happening, and 50% of it is unintended. So there are 12 million births happening every year, unintended, to teenage mothers. And most of these children end up in activities that are not really good. When the MTP Act came into act in Great Britain, they found that the number of people, the teenage people especially, going to jail was less. The crime had reduced markedly because most of these children are not taken care of and they end up in doing activities which are unwanted. One second, I'll This is a movie by Menon, where this teenage girl becomes pregnant and the mother says, let's go to the hospital. It may be some dengue or malaria. This mother handles the situation so very maturely. I do not know if I'm faced with such a situation, how I will be. But again, educating our young girls, it may happen in our family, it may happen with our students, children. So I think we should educate. All of us have to take a very great initiative. Thank you, Dr. Jairani Kamraj, for taking this topic. And this statistics says about 11.8 million adolescent pregnancies are happening in India. India has the largest adolescent population, and we have programs like Adolescent Reproductive Sex Health Strategy and Rashtriya Kishore Swasthya Karyakram. But most of them is about adolescent health, not actually about the talking about sexual education or preventing teenage pregnancies. An early pregnancy, what happens? Most of these girls come to the hospital very late in pregnancy because they don't want to reveal it early. So they miss the prenatal vitamins. The chances of abnormalities being going undetected are there, and their regular antenatal care is not there. And there is increased risk of abortions and increased rate of anemia. And this anemia, the perpetual cycle of anemia starts with this teenage pregnancy. At teenage, when her hemoglobin is not okay, when she has her own growth needs, she's anemic, she becomes pregnant, delivers, and again that anemia never gets corrected, it goes on. And most of these girls are undernourished girls. The teenage pregnancies continue most often in lower socioeconomic group. In higher socioeconomic group, most of the time it gets terminated. There's a lower socioeconomic group, it goes unnoticed and comes for a late diagnosis. And teenage pregnant girls, they have increased incidence of pregnancy-induced hypertension and preeclampsia. Because of these two factors, the incidence of preterm birth also increases. Not only because of PIH and preeclampsia, premature birth in general is in the increased incidence in these adolescent girls. It can be due to natural, because their uterus is still not doesn't have the capacity to hold the pregnancy to term, or it could be an iatrogenic because of the complications of PIH and we want to deliver early. Or sometimes, at 32, 34 weeks, when the tummy is okay, they want to deliver so that it is not revealed. At full term, it may be revealed more, so they may want to deliver early. As a result of preterm birth, the increased incidence of low birth weight babies are there. The increased incidence of low birth weight could be due to intrauterine growth retardation or because of preterm. These babies have lot of incidence of respiratory distress, and the incidence of stillbirth is very high. And even after birth, infant mortality rate is very high for these children. When it comes to labor, they are more prone for preterm labor. Their pelvis is small, their baby is large, so CPD, increased rate of cesarean section, and sometimes these people try for a normal delivery more because they don't want to have a scar, which is an evidence for a pregnancy. In case they want to get the girl to be married, then they don't want the scar. They keep trying for a normal delivery and buy quacks many times, and that results in obstetric fistula, BVF and RVF. And another important issue is to always have the legal paternity, the father's name in the birth certificate. If there is no father's name and if the girl doesn't want to reveal also, I think we should let her realize that the baby, the child without a legal paternity will find it very difficult to face the world later. Post-delivery, these women, of course, find it very difficult to breastfeed. They are young, they are mature, they themselves are, they need attention. To take care of another baby is very difficult. So breastfeeding becomes problem. As a result, the growth of the baby gets affected. And because of all the difficulties, personal problems, social problems, and financial problems makes them feel depressed. And the incidence of postpartum sepsis also is more because, again, these people have increased incidence of sexually transmitted diseases and increased incidence of infection during pregnancy and during delivery. These girls are more prone for anemia, sexually transmitted infections, and HPV infection. Early exposure to sex, sometimes multiple partners. The incidence of HPV infection is more. As a result, the incidence of cervical cancer is going to be more. And for the children of unwed mothers or teenage mothers, there's going to be malnutrition, anemia, stunted growth, and all the other psychosocial problems. What is the role of a healthcare worker? A non-judgmental approach. Never say, that sort of a comment you should never make. And confidentiality. Whatever the child reveals to you, don't reveal to all the others. Sometimes you may even have to hide it from from her parents, and approach with a lot of empathy. This is not the time to show our anger or a moral judgment towards them. And a lot of emotional support and medical support to them. Look for complications more intensely. Again, these girls do not come out with complaints so easily. So we have to be very, very careful in assessing them. And involve the mother and parents always. However angry they are, they may not cooperate, but I think we should involve the mother and the parents in these situations. And if they are still not willing, at least child welfare centers should be involved in the care. And most important, these girls may be exposed to the same situation again. Contraceptive advice is a must. Whatever sort of contraception that is possible, we should advise them. The dilemmas in a teenage pregnancy care is, like WHO advises, respect the sexual needs of the adolescent. But the legal age for marriage is 18. What if somebody wants to have sex before that? Is it a crime? And FOCSO says, sex before 18, you report to the police. How do you report a sexual activity to the police? Just like that. And we are not supposed to give contraceptives to girls under 18. But to safeguard ourselves, we can give it and then call it, we have given it for other purposes like abnormal uterine bleeding. And there are more working parents, both in the lower socioeconomic group and in the higher socioeconomic group, and there is less attention paid to these adolescents. I think all of us should stress the importance of spending time with the adolescent girl children. Children generally, especially adolescent girl children. And sex education, we should make the policy makers realize, and the school leaders, school principals or teachers realize sex education does not mean that it is to teach them about sex. It is to teach them about abstinence and safe sex till they are 18. And the media influence, definitely glorifying school love and glorifying love with a useless fellow, all these things, I think we should voice out whenever possible. Thank you all for the patient listening. Thank you, Madam Dr. Jairani Kamraj, for giving me this opportunity. Thank you so much.
Thank you, ma'am, for a crisp topic. I think you have told the points correctly regarding giving contraception advice for the teenagers. At the same time, the POSCO ties up, and you gave that clue that we can tell them that it is for other reasons that we are prescribing the rosy pills. That's a valid point, ma'am.
Yes, ma'am. Thank you so much for the elaborate talk, ma'am. Vadu ma'am and Hema ma'am.
Yeah, very nice, madam. Thank you for the talk. And even I had meet with the Namakal collector. We had a meeting. Then I suggested them like giving adolescents contraceptive pills or the boys, adolescent boys, condoms and all that. They were just laughing at us. They think this is years of age group. Adolescents, like whatever we are doing, we are like they only talk about our society and our way of behaving in our society. Like they should follow abstinence. We should teach them abstinence. That's not going to be possible at all. So I think what you said, like for contraceptive pills, it will be much better. They can go about giving. There are a lot of girls coming with PCOS, so we are treating them like that. We can say and then give them contraceptives. I think. Thank you, madam. Very nice.
It was a nice talk, ma'am. I'm in a government medical college. I bear the brunt of all this adolescent pregnancy. And every day we come across this teenage pregnancy, either due to legally, even here in our Salem, the legal marriage, legally they get married even before 18 years of age. And even we face a lot of teenage pregnancies due to that, and also a lot of illegal pregnancies. And we face many of the complications, preterm labor, CPD, and even severe preeclampsia, eclampsia, all this. I think we should educate from the school, even the school children should be educated regarding the safe sex. We can't avoid this, but we have to educate them with the safe sex. That's a better thing to do now for the younger generation. Thank you, ma'am.
Thank you so much, ma'am. Can you introduce our next speaker, ma'am, Dr. Jairani Kamraj, ma'am?
Yes, ma'am.
Slides, please.
I'm happy to introduce Jairani ma'am. She's a senior consultant reproductive medicine and a director Akas Fertility Center and Hospital, Vadapalni. And she's immediate past president of Oxy and joint secretary clean of
in a very elaborate way.
Yes. Okay, ma'am. And I'm very I think
thank you so much.
I was not there at that time, ma'am. And I invite you to give your elaborate lecture on factor associated with adolescent pregnancy.
Thank you. Can you see my presentation?
Yes, ma'am. Yes, ma'am. Go full screen.
Yeah. So thank you so much. A very special thanks to the TNFOG President, Dr. Ramani Devi Madam, and Secretary Sampath, and the chairpersons of No to Violence Committee, Dr. Kiran Mai, and Adolescent Committee, Dr. Supriya Jaiswal, and FOXY President and Secretary for making this webinar a grand success with your presence. Thank you so much for all the TNFOG societies, presidents and secretaries and all the members who joined us here for this webinar. I thank one and all. So now we are going to the other important content about the adolescent pregnancy. What are the factors which cause these teenage pregnancy or associated with these pregnancies? So this is a very important factor that we all should know, because when you look into the point of prevention, we are looking into the prevention of contraception, we are looking into the education. But what causes these adolescent pregnancy, which is really into the society and the community? So which is all our responsibility to know the factors, so that we have to plan a strategic plan to prevent this pregnancy happening in the community. Because we know the margin, almost Madam Balakumar Madam said about the prevalence, and it is really shocking to know that every day below the age of 18, 20,000 girls give birth in the developing countries. Just imagine, we are all in the South African and the South Saharan and Southeast Asian countries, we are the developing countries, we come across so many girls giving birth below the age of 18. And when you look into the other data in 2015, 16 to 18 years, around 16 million, and below 16 years, it is almost 2.5 million girls. Just imagine, they are themselves are small children, and they are going to have a children. It is a very, very sad point from the point of view from the society, as well as from the elders, as well as all in the community, to make sure that this is a very dreaded problem that we have to prevent, and we have to work on the strategic plans. And definitely there are a lot of pregnancies are unwanted, 50% or very unwanted pregnancies. So definitely there is a need of contraception or lack of awareness that only make these girls go into for the pregnancy. So we are all very much in the healthcare system to find out why it is happening, what are the factors which are very importantly known, should be a basic thing that we should know and work on a strategic plan. And very much during the COVID time, between March 1 and the May 15, within 2.5 months, nearly 2,680 cases have been reported of sex abuse, rape, and exploitation involving the children. So every day, at least around 30 children have been heading on to sexual exploitation and child abuse and rape. Just imagine the magnitude of this violence against the children, which may lead on to an unintended pregnancy. And many a times these pregnancy children that less than 15, they come without knowing they are pregnant. So much of the problem that they face through. So definitely we as a healthcare providers, as a very responsible persons in the society, we should take a strategic plan to know what causes this adolescent pregnancy, so that we have to plan proper way to prevent it. So when you look into the factors, the first important factor they look into the evidence is the peer pressure, and very second problem is the broken family, lack of parental guidance, and of course the curiosity as an adolescent, look into why it is happening, why can't we try, without knowing what they are doing, they land up into the trouble. So that is a very important point that we have to know, because that is an age they are very curious to do certain things, they do want to explore, and without a guidance, definitely they are very much at the risk of getting into this pregnancy. So when you look at the peer pressure, according to the Kaiser Family Foundation states that more than 30% of the pregnant teens reported that they felt pressurized to have sex. And that is very important. In the school, they are pressurized by the peer to have sex just because they are friendliness, and they have a friendliness with the opposite sex. Automatically they are tend to maintain the pregnancy, to maintain the friendliness, they are forced to do sex, and by that they are getting into a pregnancy. And mainly the friendship rejection or the future rejection, they have a fear, and that is one important reason. Many a times the teens let their friends influence their decision to have sex, even when they do not fully understand the consequences associated with that. That was the prevalent, that was the very much important factor. Without knowing the consequences, they indulge in sex because of They are influenced by the peers without knowing the consequence they indulge into sex. And many teenagers have sex as a way to appear cool and sophisticated, as if they are showing that they are very cool about sex. And without knowing the result that they get of pregnancy, they indulge in sex. That's the main reason for the peer pressure. Second, about the parents. The teen girls are more likely to get pregnant if they have a limited or no guidance from their parents. That's what the evidence says. Many studies have proved that when there is no parental guidance, they have a high risk of developing an adolescent pregnancy, especially a very much 15 or 16-year-old pregnancy happening in that group of children. So many times the parents were busy with their living. They have to, especially in a developing country, they are very busy with their work. They have to be busy with lot of economical constraints. They never look into the children for their guidance regarding their sexual issues, and that leads on to an adolescent pregnancy. And very important, when a teen does not feel that she can talk to her parents about sex, either because they forbid sex talk or because they are not around, she'll be more than likely to turn to friends for direction on whether or not to have sex, resulting in misinformation and possible teen pregnancy. This is a very important factor because many a times the education about the sex are not given by the parents or the teachers. It is only the students, the friends of the same age or 1 or 2 years senior to them. They only give them about their information about the sex, the contraception, and what about sex. Everything is given only by the friends, and automatically they get the misinformation and they get into the pregnancy. So very important, there is a lack of the elders' guidance, especially in the sex, especially in some developing country. We feel that talking about sex is a taboo, is a misnomer. So we never talk. Automatically, the children get a misinformation and get into the unwanted sex and leading on to pregnancy. And very interestingly, the glamorization of pregnancy, when you look into the teen marriage as well as the teen pregnancy, there is many a times it is a glamorization of the pregnancy with one reason to gain the social acceptance. They get into pregnancy. They think that they are getting matured with the pregnancy. So in that way, even a teen girl getting married at a younger age, they feel that getting pregnancy in a younger age gets them into a social acceptance. And many a times, the glamorization from the social media make the teenage girls get into the pregnancy just because they see a lot of news stories. And very interestingly, in Good Morning America, there is one famous program in ABC. They show the reckless sexual activity, and that leads to a lot of pregnancy. And they think that it is only a glamour, and they get from the social media, especially from leading things. These are all very important factors. And very interestingly, the lack of knowledge. When you look into the unintended pregnancy girl children, many times they don't know about the proper knowledge about sex. So automatically they don't know how to protect it, what is the consequences, and inadvertently they end up in a sex and leading on to pregnancy. Many a times they don't know, they don't fully understand the biological and emotional aspects associated with having sex, and that is the main reason they go for a teen or adolescent pregnancy. And these teens may get an incorrect information from friends, videos, and also from the other social media and movies. And many times they do not have a knowledge needed to make an informed and responsible decisions about whether or not to engage in sexual activity, which can alter their whole future life. That is one important aspect. And about the sexual abuse and rape, nearly around 43 to 62% of the teen pregnancy is mainly by the rape and abuse. They say about 5% of teen birth results in rapes. Many times they don't know about the pregnancy at all, and at the end of the rape they get the pregnancy and they deliver the babies up to 5%. So very importantly, the rapes. And next is the nowadays the increasing drinking, social alcoholism, drugs, they are the main important causes. The substance abuse is one important reason which makes this adolescent increase the risk of unplanned pregnancy. Many teens they experiment with the drugs and the alcohol, and thereby they lose their ability to control their impulse, causing an up to 75 to 80% of the pregnancy, which occurred between the age of 14 and 20. So this drug abuse and alcoholism is a main important reason, And according to Hale Jones area Kattenberg study, the unintended pregnancy are higher among teenagers who use substance and you are addicted to alcoholism and the drugs. So definitely a very important point of social responsibility for us to make the children aware of the consequence of drinking, drug abuse. All these things are very important need of an hour. And one interesting study by Alabi and Oni in 2017, they have identified very many factors with a teenage pregnancy as 4 important way. One is the childhood environment, that is mainly their peers and their school and their environment. Next is the low educational expectations, that's a lack of knowledge. And third is the media influence, mainly by the social media. And last, very important in developing countries is the poverty. That also will go in for a teenage marriage as well as the teenage pregnancy, because many a times when they implode into the parental cause, why they want to get their children get married at a younger age, they say we don't want to make them study, we don't want them to go get into a difficulty because they are very poverty, so they get them married soon. So this is a very important factor. And what are the childhood environments? If you look into the environment, the research says that women exposed to abuse, domestic violence and family strife in childhood are more likely to become pregnant at teenagers, and the risk of becoming pregnant as a teenager increases with the number of adverse childhood experience. So many a times the childhood experience itself will lead on to a childhood marriage as well as a teenage pregnancy. And studies have found out that boys rose in homes with a battered mother or who experience physical violence directly are significantly more likely to impregnate a girl. That's what they say regarding the boy's attitude. Getting a younger girl getting pregnant is mainly they are battered at the home, and usually they are all brought about with a abuse which happens in their environment. That's a very important one. And second, the transition from childhood to teenage may cause very many unstable emotions, which we all know, to some teenagers, and this may cause a complex teenage psychology which break the teenagers get into this activity. And very important is the complex teenage psychology. We all know the psychology of the adolescents are immature. We know that their amygdala, their hypothalamus and their hippocampus, everything has an immature way of connectivity regarding their brain network and their neurotransmitter effect. So that is one reason for their irresponsible behavior, very fastly decision and lack of emotional proper support, and acting to the emotions and immediately responding to the emotions are very high without the proper understanding of the basic things. This is very important because of their immaturity in their neurological system, which also one reason for the teenage pregnancy happening among the children. So very many factors even physiologically can happen, may lead on to their problem. And second is the low educational expectations. This is one important risk factor which has been identified in the teenage pregnancy. A girl who is not so much educated and has a mother who is also illiterate is more likely to become pregnant as a teenager. And if a mother is a teenager who has given birth to a teen, and the daughter also is more risk to go in for a teenage marriage or a teenage pregnancy. So a mother of a teenage pregnancy, usually they also may have might have been a teenage mother. So that is one important things. And next one is the adolescent pregnancy can be due to the breakdown of communication between the parents and the child with an inadequate parental supervision. This is one important reason they found out in the uneducated problem. Regarding the uneducated family, mother as well as the father. And the media influence, a study conducted in 2006 found that adolescents who are more exposed to sexuality in the media were also more likely to engage in sexual activity themselves. And they have shown that very many content in the TV who are exposed to the sexual content are more likely to get into the sexual act and get a pregnancy. And definitely another studies have proved that in the poverty situation, the girls indulge in sex activity for some petty gifts, it's a lot of food items, and also a leisure partnering for a premarital sex. And that is a very important aspect because of the poverty. They don't get a proper, parental basic needs they don't get. and they get a prey to that forces because of the poverty, just for some petty gifts and food. That is one important saddening point that we look into the community. Because of the poverty, they lead into the childhood teenage pregnancy. And definitely, many are confronted with rape through street trading and hawking. All these are result of poverty. So these are all the important factors we should look into the community level, which are the causes. So which can be really made into a policymakers as well as the healthcare providers. We should look into these factors, so that we have to educate, we have to empower, as well as we have to give them the knowledge about the contraception, and also we have to give them the proper information about the sexual practice and its outcome, which can definitely make them well empowered and educated when they come across such situations of a peer pressure or social media pressure or a poverty issue. Still, they will be very much prepared to face it in a different way when they are really given a proper care. So, according to the study of the Plan International, they have told that the minimal education, girls who have received minimal education are 5 times more likely to become a mother than those with a higher level of education. Pregnant girls often drop out of school, limiting their opportunities in future. Their career, their studies, everything is lost, and they go for a cyclical poverty. That happens because she herself could not study. She'll be dropper in the school, and they will not have any future career. So she has to look after the family, and she herself will be poverty. And many times the father of the child, he also or she will be only 2 or 3 years elder to them, and they also will be in a poverty line, and that will increase their poverty again and again. So many a times the girls perceive pregnancy to be a better option than continuing their education, will land up in the risk of developing again a low level of education, which itself will lead to poverty and increasing the teen pregnancy. So these are all the important factors that you should know from the social point of view and community point of view. And this will definitely, we have to make a point of strategy to plan things to work in the community level to correct these factors. Thereby, we can make the society empowered with the knowledge, so that we can reduce the teenage marriage and also the teen pregnancy, so that we can have a future India with a better educated and better empowered women. So with this word, I thank you one and all, and over to you, Madhu.
Yeah. Thank you so much for that clear, elaborate discussion, ma'am. Over to the chairpersons for their take on this.
Yes, ma'am.
Jaimala,
Like you rightly said that teenage moms, their children are more likely to have kids at the, when they are teenager. So we have seen women at 35 becoming grandmother. They are so proud bringing their teenage daughter, during delivery. I think this is something that we have observed through. And as you rightly said, child education is the key if we have to prevent adolescent pregnancy. So, and you are working on it, and we also would love to join you in this forum.
So definitely, Jaimala, I'm planning to have, this is a one module that we are planning to start from Chennai. So if everything goes on well, that we will make this as our Trainer 4G Federation into all the districts, will make this as a pilot work, that we can work in every district, every part of Tamil Nadu, to make this so that we can really create an awareness in the ground level of reaching to the community, to every parent, to every home, to make them aware of the consequences of the adolescent pregnancy.
Sure, ma'am. Sure.
So that we want to make the zero teen pregnancy, at least in the near future.
True.
Shanmugadi ma'am, Hemlata ma'am. Yes, ma'am. I think we will see. Shall we move on to our session 2, ma'am?
Yeah.
So it is my privilege to introduce our chairpersons for session 2. Dr. Chandra Punasamy. Ma'am is a founder president of Namakkal Obstetric and Gynecological Society, and she's a gold medalist in both undergraduation and post-graduation. And she's Also the founder president of Namakkal Women's Doctor Association and executive council member of TNFOG. And she's been a national and international faculty in numerous conferences. And she's received the IMA Best Doctor Award and Best Women Achievers Award and Isar Dronacharya Award in 2023. Next slide, please. Yeah. And I'm really happy to introduce Dr. Renju, a dear friend, who's assistant professor in Erode Medical College. And she's also the joint secretary of Erode Obstetric and Gynecological Society, former IMA treasurer in Darapuram, organizing member of Erode OG Conference. She also received the Best CMONG Doctor Award in 2018 and Best Sterilization Services Award in 2018, 2019, and 23. And she's also the nodal officer of MTM pilot phase cancer screening in Erode. Next slide, please. Next chairperson for the day, Dr. Vijayalakshmi Nyanashekaran ma'am. Ma'am is the professor, Department of Obstetrics and Gynecology at ACS Medical College in Chennai. And she's a honorary treasurer of TNFOG from 2021 to 23, executive council member of OXY from 2021 to 24, and past honorary secretary of OXY. And she specializes in high-risk obstetrics, adolescent gynecology, and infertility. So with the second session, I request our chairpersons, Dr. Chandra ma'am, to please introduce our first speaker.
Good evening, everybody. It's really a proud privilege to be on this platform, to be with pioneers of Foxy, and especially it's an extra happiness for me to share the platform with my daughter-in-law, Dr. Madhumita, on her birthday. And now Dr. Vijayalakshmi has told that she couldn't join. So only me and Renu will be the chairpersons. And I congratulate Dr. Jairani, and I thank her for this opportunity and congratulate her for her wonderful topics selected, which is the need of our adolescents. So now I introduce Dr. Vivek Madi, who is our next speaker. He is the consultant and director of RK Malati Hospital, Chennai, and he is a faculty of the Department of Education, International Chair in Bioethics, and he is the steering committee member, Biolaw Department, and International Chair in Bioethics. And he is the Reproductive Health Law Vice Chair, ICB, an international honorary committee member of the 16th World Conference on Bioethics, Medical Ethics, and Health Law. And he is a EC member of OXY and KMC Association President 2007 to 8, and IMA North Chennai Secretary during 2006 and 7. Please, Dr. Vivek, now you are on the.
Thank you.
You are welcome to talk on your topic.
Yeah, thank you very much for the kind introduction. And I also thank the organizers of this webinar on adolescent pregnancy, the Foxy No to Violence Against Women Committee and Tamil Nadu Federation of Obstetrics and Gynecologists for asking me to talk on this topic. Yes, it's very important in today's perspective, because we are seeing even in the news items a lot of talks on POXO and things like that. So it's very important that we know what the law is. So I would first concentrate on talking about the few questions to answer, and then I go into the POXO Act, and finally I'll give in certain scenarios, dilemmas which doctors would face and how to come across that. So the question is, what is child sexual abuse? And how can we identify or suspect child sexual abuse in the clinic, symptoms and signs, and what are the common myths and misconceptions? Yes, it is an act using a child for sexual gratification, resulting in actual or potential harm to child's health, survival, development, or dignity. We have noticed that there are a lot of cases have been reported, and it involves both girls and boys. And the major age group is between 12 to 15 years. And today, more than 50% of sexual offenders are known to the child, are in position of trust. So, though the topic is on teen pregnancy, I would like to first tell you we need to identify these women, these children at a young age, who are having symptoms of sexual abuse, because only then we can go on to the next of addressing a more aggravated offense of pregnancy. A child could present to you with behavioral difficulties, challenges, and then there could be poor attendance of child in school, or regressive behavior such as bedwetting or thumb sucking, or maybe even not attending to you, or they could be having frequent quarrels with the parents, sleeping disorders, difficulties, fatigueness, and sometimes you could sudden accumulation of
Hello? Hello, Dr. Vivek?
I think first connections there's some problem. It's just freezed.
boys are also
Yeah.
vulnerable. And then, do you think it cannot be stopped? No, it can be. It's easily detectable. Is it because girls are wearing revealing clothes? It always includes physical contact, or maybe it's because they are coming from not so educated families. So these are myths. But then you need to know what the POCSO Act is. It is protection of children from sexual offenses. And when did it come into existence? In 2012. It's a special law because it is the need of the hour. It has been passed to address the issue of sexual offenses against children. And the objectives of this act was to protect children from offenses of sexual assault, sexual harassment, and pornography, and to establish special courts for speedy trial of such offenses. You need to know the definition of child, because anybody less than 18 years is a child. And I'm going to talk to you about sexual harassment. What is sexual assault? Penetrative, aggravated sexual assault. The POCSO Act is a gender neutral law. Though I'm talking today on pregnancy, yes, this law is for both girls and boys under the age of 18. And it ensures punishment for all perpetrators, irrespective of age and gender. And POCSO at a glance is that it is meant to establish special courts for speedy trial. And the main thing is you should know for us is Section 21 of the POCSO Act says failure to report an offense under POCSO Act is 6 months to 1 year imprisonment. So there is a definite section here that we need to report, and that is Section 19. And failure to report is also an offense. Here again, I come to the first definition of the child. Anybody less than 18 years. So when you are treating anybody less than 18 years, you have to think about there's an act that we have to follow. There's a law. And then the reason why the law is coming to place is because the crime is increasing and we need to put a full stop to this crime. And there's certain special sections. That is Section 5 is very important. Aggravated penetration sexual assault. When penetration is committed by a person in possession of trust, it could be a member of security force, police force, public servant, father, or a teacher, anybody. And this aggravated penetrative sexual assault leads to a pregnancy. It is an aggravated assault, which today people are asking for death sentence. Right now, because of the pressures, they have made it into life imprisonment for this assault. Definition of sexual assault, Section 7 says, whoever with bad intention touches the private parts of a child, be it a male or a female child, and makes the child do so or does any act with sexual intent, and which involves physical contact without penetration, is said to be committing sexual assault. And punishment is 3 years up to 5 years. And what is sexual harassment? With any person with sexual intent utters any word, sound, gesture, or a displays or exposes any part of the body with the intention of child would hear the sound or see the part of the body is said to commit the offense of sexual harassment. Showing a pornographic film or using a child for pornographic purpose, all of this. Now, these are definitions. I'm sure all of you you know about it, but what is pertinent to us gynecologists is this section 19. It is about mandatory reporting. Mandatory reporting means it's a legal duty upon us as doctors who have the knowledge that a child has been sexually abused to report the offense. And failure to report is a punishment of 6 months imprisonment. But then we need to adopt a very child-friendly, we need to be empathetic to the child victim. We need to raise the concern with the people who are close to the child when we find it. And we need to inform the child line. Remember, 1098, there's a specially designated child welfare committee which looks into these problems to look after the child. Because sometimes it will be a family member who's the abuser, and the child needs to be taken out from their house and need to be given a separate shelter. So all that is looked after by the child welfare committee. And then you have the police to bring the accused to books. So these are, and we need to be sensitive while discussing the incident, especially the privacy of the child is very important. Privacy and confidentiality of the child is to be very much maintained. We need not talk to the media. In fact, the media is banned for reporting the name of the child. And what are the procedures? Yes, we need to inform the Special Juvenile Police Unit. And if you're not aware who the Special Juvenile Police Unit is, at least to the local police. It could be anybody. Actually, the law says any person who could be even a person who's working in a hotel, if he finds a child is being utilized for pornography or for prostitution, anybody who comes to know, even a lodge, a person who's in the media, studio, photographic facilities, anybody who comes to know has to report this crime. And that's how severe the lawmakers have thought about it. And procedures are, yes, this is important because the police or the juvenile police unit should make special arrangements to give the child care and protection. They should report the matter to Child Welfare Committee within 24 hours of recording the complaint. And steps should be taken to admit the child into a child shelter home or nearest hospital within 24 hours of the report. It's also important that no person shall incur liability, either civil or criminal, for reporting the commission of an offense. So you don't need to be afraid that, oh, am I giving a wrong information and things like that. What if we fail to report the case? Are there any punishments? What if there are false complaints? Yes, failure to report the case, any person in charge of the company or institution, or by whatever name. See, like noticed there was some offense taken recently in Maharashtra. 2 children, 4-year-old babies, girls, were abused by the somebody who's working in the school. So, in fact, the principal is also being called in to why they have not reported the matter. And so it's important that if you are in a very senior position, your juniors are doing the crime, all the more necessary for you to make the complaint. Remember, false complaint by child is not punishable. And do we have a special court? What are the rules? Yes, we do have a special courts which where the judgment is to be given within 1 year. And it's all been designed so that the child doesn't go through a second traumatic experience. And what are these designated courts meant for? The mechanism is for reporting, recording of evidence, investigation, speedy trial offense, all are child-friendly mechanisms. And the police are cast in the role of child protectors during the investigative process. They also have the responsibility of making urgent arrangements for care and protection of the child. It also provides for special court to determine the amount of compensation to be paid to the child. The attempt to commit an offense under the Act has been made liable for punishment. So there is a procedure, a process which elaborates. But more important is the guiding principles for pre-trials and trials. What we need to take is the best interest of the child. And more important is the privacy of the child is to be maintained. When we are interviewing a child, what are the things we need to find as doctors? We need to find out when the assault took place, what time, place, frequency. Was there description of the child worn clothes? It's important all this is done by an experienced doctor. So an experienced doctor know who's been handling children and young teenagers needs to be the interviewer. By a trained professional is very important. And interviews are forensic rather than therapeutic interviews. We need to be sensitive, unbiased, and truth-seeking. The purpose of the interview would be to support accurate and fair decision-making in criminal justice. And reason for interviewing the child is to get a clear picture of the child's physical and emotional states, to find out who the child trusts. Sometimes when we are in a teaching college and things like that, whenever there is a MLC case, we always ask for an FIR. No, but in a POXO case, it is not necessary for waiting for an FIR to be registered. It's more important that we give emergency treatment. It is there in section 27 itself clearly says that emergency treatment needs to be given irrespective of any procedure to be taken. And it's important that we protect the privacy of the child. All examinations should be done in presence of the parent or guardian or any other person in whom the child has trust and confidence. And it's also important that we do not charge the patient for the services we do, and we don't need to demand for any legal or magistrate requisition or documentation as a prerequisite to rendering such care. And the section provides that all hospitals are required to provide first aid or medical treatment free of cost to victims of sexual offense. So this is very important. And an examination. So there are guidelines, special care, special precautions. How do we take consent from a child? Is it this assent that is important? The presence of the parent and guardian is important. More important, it is a teamwork. We involve a pediatrician, pediatric surgeon, pediatric anesthetist, a teamwork, and maintaining privacy is very important. Mostly it should be an in-camera. It should be in a very secure place. Child is comfortable with, and it's presence of the child. And if it's a girl, it should be examined only by a woman doctor. What about first is there look for in a government college, because a medical practitioner employed in a hospital run by a government or local authority is the first place of attendance. But in the absence of such a place, yes, any other registered medical practitioner can also examine and give their examination details. There are certain procedures to be followed. What if questions do come across? Yes, do sedation need to be given? What if you speculum examination to be done in a pre-pubertal child without anesthesia? All these questions might arise. What's most important is we have to look in the best interest of the child. The child's consent is very important. If the child says no, we need to respect that no. And the role of medical professionals in the context of POXO Act, yes, the role of a doctor may include having in-depth understanding of sexual victimization, the child's experience in facilitating, being judgmental, and having empathetic manner. Examination should be in such a way, and meticulous documentation is very important, especially taking your details, back details, their previous histories, is very important, and conducting a detailed examination to diagnose acute and chronic residual trauma and STDs, and to collect forensic evidence. That's very, very important, to collect that forensic evidence. And considering a differential diagnosis of behavioral complaints and physical signs that may mimic sexual abuse. Maybe the child may be mimicking a psychological problem. It could be obtained, and we need to obtain photographic and video documentation of all diagnostic findings that appear to be residual to abuse. Formulating a complete and thorough medical report with diagnosis and recommendations for treatment. And testifying in the court is most necessary after all this. These are now let me go to certain case scenarios. How do we? These are my recommendations. A married pregnant woman visits your antenatal OPD. She mentions her age as 17 years. These are common problems. What are you supposed to do? Do you ignore it or inform the authorities? The POCSO Act clearly says, yes, the marriageable age, even the child marriage law, there is a law that says it's illegal to have child marriage. Anybody less than 18 years is called a child, and they cannot get married. If you find, yes, local laws are permitting marriages, the best thing is ask them to go to the court, get a judge's opinion, because we also respect certain customs of certain minority religions. So we need to respect their wishes. If they say, yes, this is a true marriage, a legal marriage that has been taken. And for such, if you have in doubt, send them to the court, tell them to get an order from the judges to say, yes, they are allowed to give further treatment. But the law says, if you come across anybody less than 18, you need to inform the police authorities. Tell them, yes, alternative for them to get an order from the court. If the age is 18 now, are you supposed to verify the age if you suspect somebody less than 18? Yes, it is. Aadhaar card. Today, it is very easy to have an Aadhaar card. Everybody has an Aadhaar card. You ask them to get an Aadhaar card to prove the age, or they have a birth certificate. That's also good enough. Second scenario I'd like to go is, what about unmarried woman? She's 23 years of age. She comes to 12 weeks of pregnancy, wants MTP. What is your plan of action? Yes, this is an adult, but she's unmarried. Today, yes, it's a choice we give to empower women to make a choice on which pregnancy they want to carry. If it really doesn't matter if she's married or unmarried. Today's scenarios changed. What we need to know is it consensual sex or non-consensual sex? Does she want to take action on the person who's responsible for her pregnancy, or does she want to have the baby and she wants to pardon the person who's responsible for her pregnancy? If she says, yes, it's consensual sex, it is in our interest to take a letter from her to say that this was consensual sex and she doesn't want us to inform the police. If she says that, then we are not liable for any medical legal problems. The third scenario where you're likely to come across is when a 15-year-old comes with 12 weeks pregnancy. She's been pregnant twice, aborted once. She has no mother and she has no proper caretaker. She's not educated. Father's unemployed, poor. Father wants daughter to try in pregnancy. So he knows who's responsible for the pregnancy, and he doesn't mind this girl going through the same trauma again and again. He's unaware. What we need to do first is counseling. We need to counsel the girl, counsel the father that this is wrong. We need to know that each pregnancy will cause a psychological problem to her, a physical problem to her. The complication of teenage pregnancy should be told first. And we should be made aware about the law of the land. The law of the land says, yes, you need to report this pregnancy to the police, because this cannot go on. What if she says, yes, we need to, she's agreeing for termination of pregnancy? Even then, you need to tell it to the police and ask them to get a court order, if at all, if they who don't want this pregnancy to be informed. It's always better, let the judges take the thing, because they see the perspective, they see why this is happening. And do we encourage such pregnancy? Do we first put a property inside to prevent, if the father wants termination and putting a property? No, we can't let them carry on with this type of lifestyle of a repeated pregnancy. So any method of even putting a property makes us doctors liable for being compliance with the law and allowing them to do this crime. So we are not allowed to be a part of this criminal act. Then the fourth scenario I would like to say is a 16-year-old. She's 32 weeks of pregnancy. So she's unmarried, severe anemia. Didn't want information to police. What's next? She's absconded, visited all private doctors, RMPs for termination. She's ready to go to a quack also. Well, she needs first treatment. She's severe anemia. She needs to be admitted. Anemia needs to be corrected. That is first and foremost. She needs to be treated. We need to save her life. Then comes the 32 weeks of pregnancy. So, medical termination of pregnancy is only allowing minor termination only up to 24 weeks. So she's beyond 24 weeks. So the law doesn't allow us to terminate this pregnancy. Possibly we'll have to keep her there, let her deliver, and hand over the child to Child Welfare Committee to look after. We need to then counsel her, find out who's responsible for this pregnancy. Counseling is more important than anything else. We need to do our duty of informing the police about it, informing them. But more important is treating the patient. The fifth scenario I'd like to bring across is when a 17-year-old girl, she's run away from home with her 18-year-old boy. She's 5 months pregnant. Both have got married with elders' consent. Is it POXO? Do you inform the appropriate authorities? Yes, it is POXO because the girl is less than 17 years. Maybe they have got consent from the elders. Yes, but they have done a crime. The law doesn't allow a 17-year-old. They want to put a stop to teenage pregnancy. The law has gone ahead, well ahead. You see the magnitude of this problem. We have 50 crores children in this country, and 50% are being abused some way or the other. And many of them are going on to teenage pregnancy. The lawmakers have come to know about this problem, teenage pregnancy, and they want to put a full stop to this. They feel that only the law can do this job, and all we have to do is follow the law. And therefore, in this scenario, the law has put a mandate on doctors to report. It is our duty to report, irrespective of what happens to the child or to the parents of the child, whatever the requests are. It's our duty to inform. The rest, the law takes into place. Maybe nothing might happen. They might get away with the crime, but that's not our problem. The lawmakers want us to do is to report the crime. And with that, next scenarios. What if the police is also reluctant to take down the complaint? If the police refuse or ignore, and how to inform? To whom? Phone, mail, letter, how to take acknowledgement? What about the role of child protection and welfare department? How to safeguard ourselves in our practice, and how to avoid medical legal hassles and do safe practice with regard to POCSO while safeguarding interests of the victims. Yes, all this answer is very, very difficult because it comes with a lot of emotional baggage, I would say. But we need to do our duty. And if the police is refusing to take the complaint, we need to go to one level higher level. If the local police is not taking it, you have the commissioner, the joint commissioner. All these people are higher level police officials. You can send a letter to them, get an acknowledgement, keep that acknowledgement, because the law expects us, we need to safeguard ourselves. And what safeguarding is the acknowledgement, a documentation that we have done our duty. That's it. What happens next is not our problem. But there is a mandate on doctors to report this crime. And there's a reason why this has come across. The lawmakers have seen all the angles and they have made it a rule. And we have to follow the rule. Thank you. And we need to protect our children.
Thank you.
Any questions?
So
thank you so much for such an elaborate talk, ma'am. Now over to the chairpersons for their take on this topic.
Thank you, sir, for the elaborate and lucid presentation. Renu, you want to take up?
Yes, ma'am.
Yeah.
That was an excellent presentation, sir. Actually, I work in a government setup, so I had come across many POCSO cases. I've seen and examined so many patients, many young girls actually. The perpetrators are usually the conductors and the Xerox paper guys in front of the school, and uncles, stepfathers. Those are the most common perpetrators we come across. And of course, the small boys and the men who study with them in the colleges and the schools. I used to get very angry initially when I go to the courts, because I'll be like asked so many questions. I'll be very irritated with the girls because mostly they'll elope with the boy and the uncles or whoever it is. It happens by mutual consent. Why am I being subjected to such a all the cross questions? I'll be very angry. But now I really understand. The girls whom we usually examine are very timid and they are inborn guilty and they're not their usual bubbly self. They lose themselves because of this. So I really understand that this is the need of the hour, and you did an excellent presentation, sir. Everything that we had seen, you had listed very beautifully. All the doubts we get, that was also addressed properly.
Okay.
Sir, I have a question for you.
Yeah.
If a girl is brought by her parents suspecting some sexual abuse and we found some injuries, and they want to keep it as confidential, should we treat that injuries and send it home, giving respect to their parents' opinion?
Yeah.
No need to inform police and all, or should we?
Yeah.
We have to.
Yeah, we have to inform the police, but same time we have to maintain the privacy and confidentiality of the child by not telling to media. Section 23 clearly says that we need not inform the media or to people who are not related to these things. We need to inform the police. The police will call the parents, and if they let them decide. That if the parents say not to go ahead with the investigation, it's up to them. But there's a duty to put on us to inform. That's it. The investigation is done by the police. Will they catch the perpetrators, the accused, or not, is depending on the police.
So the impact of POCSO Act on this adolescent pregnancies before that act and after that effect, what is your
yes, definitely it is. Right now the awareness of this POCSO Act is not coming. Right, a lot of TV programs are coming in, so slowly people are coming to know about it. Even 2 days back, there's a thing that has happened in Maharashtra. So more and more TV media is bringing up this problem. All we need to do is need of ours bringing awareness. Slowly, people need to know there is a law, and the law is a very severe law. It's not life imprisonment is the thing for the law. The law says the accused will be in jail for life. And people are asking for
I
death sentence to be
I had
brought in.
gone to Mahila court, ma'am, and it is a really speedy trial. Around 90 to 20% they have been imprisoned. Around 7 years punishment they had received.
Earlier it was 7 years. Now recently they made it to life. So that's how severe it is. The courts are taking into very serious into this problem. And so all we need to is bring awareness to people that there is a crime, please don't do it. See, earlier people used to rob and things like that. Now, because there's a law, robbery, everything has come down. Once you know, yes, there is a law and people will get caught, raped, everything will come down with time. All we need to is bring awareness to people. And even child marriages will change. People will wait for 18 years. Nobody knows that, yes, you can't get married till less than 18 years. This is awareness is not there. There's a law, but nobody knows about it.
Many
the
times the
Vijayalakshmi is
grave part
growing.
of it is the boys innocently when they end in a consent. I mean, it's a consensual. Pregnancy, and sometimes they go for the past, so their whole life is getting lost because
Yes,
the
yes.
boys they get arrested and they go for 7 years, and that is a very very grievous imprisonment they have, and almost the entire future of the boy is also lost. So all these things has to be given a proper counseling for the students, especially in the schools. Not only the girls, the boys also has to be educated, because they also go into a land in a problem when they come across do a consensual marriage, even a teen marriage and teen pregnancy. Just the boys also they get into trouble. So we all should be very much educative to the students, both the sex.
Yes, that's what very, very, very clear message, madam. Both conveyed by Dr. Vivek, and your points are beautiful. This is what I wanted to tell. We are doing a lot of programs in schools for girls where we are educating them. We should do a lot of education for
also.
boys and tell them, yes, this is going to lead to problem. And it is going to be now, it's not even 7 years and it is life imprisonment. Only when we convey that message, it is going to reach the boys, and these kind of activities are really going to stop. And I do not know, something wrong with my signal and I was unable to go out. I again come and go and come in. Say thank you, Jairani madam, for this opportunity. And that was very lovely, Vivek Madi sir, listening to you. Thank you so much.
Thank you.
Dr. Renju, you will take over for the next one, please. Renju.
Okay,
I
ma'am.
think
She
you
said
will.
it's not
Vijay,
there,
you
ma'am.
can,
Can you introduce the
continue,
next
Vijay. Introduce Supriya.
Speaker, ma'am? Yeah, can I? It's
Dr.
really
Supriya.
a privilege to introduce Dr. Supriya Jaiswal. Can I have that slide? Yeah. Madam has been introduced already in detail, but still it is good to repeat it again. Consultant obstetrician from Patna and Mancore trainer and as HPV project. And now she has taken up adolescent. It's been a passion from the words she had mentioned as a special guest when she was here for the inauguration, during the inauguration time. And she has done so many publications in Foxy GCPR, Focus, Foxy textbooks, everything with adolescent gynecology, menstrual hygiene. We are really, really proud to have you, madam, as the chairperson of the Adolescent Health Committee. Welcome, Dr. Supriya. Over to you, madam.
Thank you, madam. Thank you. Thank you for your lovely words. I just share. One second. So shall I start my talk?
Yes, please.
Yeah,
Yes,
yeah,
ma'am.
Supriya.
Yeah, because so I'll be talking on prevention of adolescent pregnancies, the need of the day. So before that, I really like to thank once again Dr. Jairani and No to Wow Committee of Foxy along with the TNFOG. Thank you very much for giving me an opportunity to talk on this important subject. So what is adolescent pregnancies? This refers to pregnancies that occur in girls and young women between the ages of 10 and 9. Adolescent pregnancies are a significant global health concern, and complications from pregnancy and childbirth are the leading cause of death among girls of this age. worldwide. So according to the WHO, approximately 11% of all the birth worldwide are to girls of this age group. In 2020, an estimated 4.5 million girls of 15 to 19 years of age gave birth, with 1.4 million of those births occurring in girls under the age of 16 even. So, adolescent birth rates are vary widely across regions and countries. Sub-Saharan Africa, you will see 102 births per 1,000 girls of this age group. South Asia is different. Latin America and Caribbean cities, Europe, North America. We will not go into much detail, but these are the data that we have collected from. So, countries with high adolescent birth rates, that is more than 50 births per 1,000 girls of this age group, is Niger, Mali, Afghanistan, South Sudan, and then countries with low adolescent birth rates are these: Switzerland, Japan, Italy, South Korea, and Netherlands. So it is just a rough review. So adolescent pregnancy scenario in India. India, according to the National Family Health Survey of 2019-21, 7.9% of women aged 15 to 19 in India have begun childbearing. So adolescent birth rate in India 27.6 6 births per thousand girls of this age group. This was given that this data was collected. So Save the Children found that this was an association that found that annually 13 million children are born to women under age of 20, that is worldwide, 90% in developing countries. So India is also comes under the developing countries category. The characteristics of the young mothers are common across the regions of the world. What is the main factor? Like little or very less educated people, rural dwelling people, and low income. So this is the main global issue for having this adolescent pregnancy. The relevance of adolescent pregnancy to the Millennium Development Goals is adolescent pregnancy contributes to maternal mortality, adolescent pregnancy contributes to perinatal and infant mortality, adolescent pregnancy contributes to the vicious cycle of poverty. So, addressing adolescent pregnancy is important for achieving the MDGs to reduce poverty, childhood mortality, and maternal mortality. These are the goals. Prevention of too early pregnancies within or outside the marriage, prevention of unsafe abortions and death due to abortions, prevention of death during pregnancy and childbirth. So these actions should be close linked with actions to prevent HIV. So you have a strong association with the adolescent pregnancy. Lots have been talked about by our esteemed previous speakers, even about the pox. So what all happens by Dr. Jairani. So we know lots and lots, but we need why this happens. The lack of education on safe sex. That is why the CSE is becoming famous these days, comprehensive sexuality education in the schools. So the lack of education is the main reason. Peer pressure is another very, very important. This has become a topic of discussion in many, many forums. Peer pressure is very important for the adolescent community. Drugs and alcohol, unprotected intercourse. A sexually active teenager who does not use contraception has a 90% chance of becoming pregnant within 1 year. Potential behavior patterns for the teenage girl becoming pregnant include early dating behavior. They start looking at their peers, they start early dating. Lack of a support group, nobody tells them what is right and what is wrong. Unhealthy environment at home. Stress and depression is another big issue with the adolescents. Delinquency, criminal behavior, exposure to domestic or sexual violence, and most important, financial constraints. A range of social, cultural, biological, and service delivery factors contribute to the high level of adolescent pregnancy and childbirth. Declining age of menarche. The age of menarche has declined, especially in urban areas. Even 9 years. To me, I have seen a girl who came, just crossed her 8 years completed, and the beginning of ninth year, she got the menarche, and they were all panicking, the whole family. So we had to counsel them, and then so this is important reason. Then duration of education and societal demands. A growing number of adolescent girls are allowed to go for higher education and marry late as a result. But in rural areas, marriage still appears very early for young girls. They are then pushed into early motherhood. Naturally, once they get married, they don't know how to keep their to stop this and contraception. They don't have knowledge about all this, so they become they get motherhood earlier. Early initiation of sexual activity is on the increase these days, very, very much. Sexual coercion and rape figures prominently in the lower socioeconomic strata. Pregnancies are not the only result, but also serious physical and psychological complications. Now, disruption of education also influences adolescent childbearing, as women with little or no education are more likely to become mothers early. Socioeconomic factors, as we said, often forces young girls into sexual exploitation and prostitution, and compounded by lack of access to contraceptive services and inability to negotiate condom use, the young girl may soon become pregnant. So, lack of access to information has a significant bearing on early pregnancy and childbirth. Lack of access to services leads to risky pregnancy and unsafe abortion, etc. Adolescent pregnancies tend to be highest in areas with the lowest contraceptive prevalence. Contraceptive prevalence has increased mostly among older married women and not adolescents. So, adolescent pregnancy can lead to health risks, as all of us know, for both mother and child, disrupted education and future opportunities, increased poverty and economic dependence, and emotional and psychological distress to the young mother. Health effects, as you know, higher risk of for anemia, pregnancy-induced hypertension, lower genital tract infection, low birth weight babies. These are the other difficult situations that they face. Then social isolation, guilt, stress, depression, low self esteem, resulting in lack of interest in studies, limited job prospects, and lack of a support group or few friends, to name just a few. So, lack of access to education and family planning resources, limited knowledge about reproductive health, gender inequality and discrimination, poverty, and economic vulnerability. So these are the comprehensive sex education in schools. How do we prevent? These are the very, very important things to make people aware. What I feel, rather reading the literature or anything, what we experience from our day-to-day life, that comprehensive sexuality education in schools is mandatory, that the children should be aware of what is what. They should know what is important, what is sexuality, what is everything they need to know. Then access to family planning resources and contraception. Although we cannot write on the prescription, but then we have to empower these girls. Empowerment of girls and women through education and economic opportunities, then community engagement and support for adolescent health. Improved health outcomes for adolescents and their children, increased educational attainment and economic opportunities, reduced poverty and economic dependence, enhanced overall well-being and quality of life. Then, what the role of government is important. Governments, NGOs, and communities must work together to prioritize adolescent health, increase access to education, family planning, and reproductive health resources, support and empower adolescents to make informed choices about their health and future. So, adolescents in 2030, we need action for adolescents, deliver the promise what we have done, then reach our goals. This should be in 2030. If everything goes well and people are made aware. So, important points are like education and awareness, like I said, how to prevent this, implement comprehensive sexual education programs in schools, focusing on reproductive health, consent, and healthy relationships, access to contraceptives, as it is said so many times, ensure availability and accessibility of contraceptives, including emergency contraceptives for adolescents. Then family and community engagement, encourage open communication and support networks within families and communities to promote healthy relationship and responsible behavior. The adolescents should be open to their parents. The parent and the adolescent, their conversation should be very, very open, and they should not get angry listening to that. They should try to help them. So, and healthcare services provide confidential, adolescent friendly healthcare services, including reproductive health checkups and counseling. Economic empowerment, as I said, offer education and job training programs to empower adolescents, especially girls, and reduce the economic dependence on partners. So, Indian government has initiated programs like RKSK, that is Rashtriya Kishore Swasthya Karyakram for adolescent health, Beti Bachao Beti Padhao for girl child empowerment, then Pradhan Mantri Surakshit Matritva Abhiyan for safe motherhood. These efforts aim to reduce adolescent pregnancies and promote overall adolescent health. One sec. Health and well-being. Then comes develop and implement national policies and programs addressing adolescent reproductive health. Rashtriya Kishore Swasthya Karyakram, School Health and Wellness Program, Beti Bachao Beti Padhao, and Pradhan Mantri Surakshit Matritva Abhiyan. These are very, very important programs run by the government. So we have to allocate sufficient funds and resources to support adolescent reproductive health initiatives. Partner with non-governmental organizations, community groups, and stakeholders to amplify reach and impact. Establish monitoring and evaluation system to track progress, whether it is working or not, identify the gaps, and inform data-driven decision making. Enact and enforce laws protecting adolescent rights, such as access to reproductive health, healthcare, and protection from child marriage. So we have to provide a safety net, making emergency contraceptive pills widely available and accessible, providing safe abortion services where legal, or providing effective post-abortion care. Now, coming to the finally, lots have been spoken about this. So the take home, what I think is best is comprehensive approach, that is adopt a comprehensive approach addressing education, access to contraceptives, family and community engagement, healthcare services, and economic empowerment. Adolescent centered, prioritize adolescents' need, perspectives, and participation in program design and implementation. Cultural sensitivity, that is ensure programs are culturally sensitive, accessible, and inclusive for diverse adolescent population. Long-term commitment, like recognize prevention of adolescent pregnancies as a long-term commitment requiring sustained efforts and investments, because it can't be done in a day. We have to keep on trying and trying. Collaborative effort, foster a collaborative effort among government, NGOs, stakeholders, and communities to achieve lasting impact. And we doctors, we healthcare workers, we have to really be very, very efficient in doing this, and sustained effort will really bring the results. So thank you very much for the patient listening, although it is too late now. So thank you so much for the opportunity, Dr. Jairani. Thank you so much.
So we are on time, Supriya. We have started at
Okay.
7:30. We have finished at 9:30.
Oh, okay, very nice. Oh, yes. I can. Thank you so much.
That was
All
such
of
a
you are there.
wonderful, elaborate discussion, ma'am. Thank you so much. I
Is it?
request your chairperson, I request the chairpersons to give
Yeah.
your view on this.
Yeah, Dr. Supriya Jaiswal, that was indeed a very comprehensive talk. Beautifully, you have designed it. It was a fantastic presentation on adolescent and how the preventive aspects of it. That was lovely. Thank you so much for joining us late in this hour. Thank you so much.
Thank you, Supriya.
Jairani ma'am, thank you so much.
Supriya. It's very so nice of you to come in midst it, because your brother is having high fever. Even with that, you have so much passionate to join us, and we really thank you for joining us. And very nicely, you have pointed out the sustained work. We have to keep on talking, creating awareness, doing a lot of community related work, so that this message can reach the community, so that there will be some change which will definitely happening in the future, which can prevent this adolescent pregnancies among the.
Yeah, I think Dr. Chandra madam is lost. So, but she has sent a message. It really, madam, she feels that it is our responsibility to the society. The society has given us so much, we have to give it back to them. And yes, we will do it. A very good adolescent program. That was a fantastic program. Thank you, Jairani madam, for the program. Thank you.
Thank you, Dr. Supriya, for this.
Chandra ma'am, we are all planning.
Yeah, Chandra ma'am has joined.
We have started one program for the community related. The MSW students, B.Ed students, they are all having a projects to work in the community. We are training them to go into the community to work, and they will be doing. They will be doing a lot of programs. They're 6 months of the project work, and they will give a feedback to the area where they work. And an NGO, we have connected with the NGOs. They will go and help them in doing this work, so that we want to make a real impact, and we will definitely make a good module And the same thing we will be implementing all through the states through TNFOG, all through the districts with the TNFOG. And definitely, Supriya, this can be taken even up to the national level. That's what me and Kiran were talking, and we are working on it. And definitely, it will be a real changing trend that will happen in the community level.
And I want to add one more thing. Thank you, Dr. Supriya. You have done justice to your topic. It was excellent. And Jainani, we are all going to girls' school only most of the time. We must, yeah.
We should go to the boys' school also.
Boys' school. That is more important, no?
You are very correct, ma'am. I have been to the government corporation schools where they have a, co-education, and it is really to talk between them to say about their crush, about their feel, how it is having an impact in their thing, and even the boys, when they talk about the night sweat, they had a lot of misconceptions about their night ejaculation, night emissions. All these things made them realize that it's a physiological one, and how they have to face it, how they have to emotionally balance when they come across that emotions. All these things, when they are as a co-education in a group, that really open up a lot of nice interactions among them, which can make them really a good, friendly approach among them without any gender bias, without any gender disparity. That will help them to have a good bonding and to understand each one's feeling for the others, which was very good in a way that they can prevent all these mishappenings.
Thank you. Thank you. Thank you very much. Thank you.
Actually, so impressive, ma'am, to hear about the amount of work that you're doing, actually. Like, I think it has to be implemented almost like even smaller places. I think we have to start. Yes.
Yeah.
It's really impressive.
When you do conferences and all, you must bring these adolescent girls and boys to do one session for them.
You know, madam, just to tell you, we had a adolescent conference in 26 and 27, 28 July recently in Patna. So we had that very good public forum, and 90 to 100 girls, schoolgirls, we brought them in the public forum, and lots of things, peer pressure and all these screen time limits, they were discussed, and lots of lawyer, school teacher, principal, all various people were put into that. And Dr. Nilja Bhatla, who is the VP in charge of this committee, adolescent, she was there, and they really loved the session. It was a great, and the children, they participated so nicely, the school girls. So we had a wonderful session. So in the conference, we really need to do one session about this, adolescent. Thank you.
Thank you all. Thank you all so much. That was really lovely.
Thank you so much, Madhu, for the wonderful MOC on your birthday.
Thank you so much, ma'am. Thank you.
Missing your dinner and joining with us.
Madhu, happy birthday. Happy birthday,
Ma'am,
Madhu.
thank you so much, ma'am.
Very special thanks to Chandra ma'am, very special to Supriya, Ranju, Jayamala, and Madam Balakumari madam, everybody, Vivek, everyone had a very good, within a short notice, we could make this webinar, and really we look forward of doing very many programs all through in the future. And I thank one and all for all your presence, and a very special thanks to Sri Priya as well as to Sheel Sahiti for making this platform, giving us a platform, do it in the best way. Thank you so much.
Thank you, madam. Thank you all.
And
Happy birthday, Madhumita.
Thank you, ma'am. Thank you so much, ma'am. Thank you.